Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In the frenetic pace of modern life, stress often becomes an unwelcome companion, particularly amidst the chaos of a busy work schedule. This relentless pressure not only weighs heavily on our minds, but also exacts a toll on our bodies, especially our hearts. In this intricate dance between stress and health, finding moments of reprieve becomes paramount. Prioritizing self care, adopting stress management techniques, and fostering a supportive work environment are crucial steps in safeguarding against the silent threat of hypertension. In embracing these insights and implementing strategies to manage stress, today's discussion offers a pathway towards alleviating the burdens of hypertension, paving the way for a healthier and a more balanced existence. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and to help us navigate the complexities of stress induced hypertension, we have with us the renowned medical practitioner, Dr. Kashyap Dakshini. Dr. Kashyap Dakshini holds a distinguished reputation in the medical community, leveraging over 2.5 decades of experience across various hospitals and clinical healthcare settings. In addition to his clinical expertise, Dr. Kashyap actively contributes to professional organizations, serving as office bearer, treasurer, and member of the managing committee of the Indian Medical Association, Mumbai. Furthermore, he is esteemed as a member of both the Indian Association of Occupational Health and the General Practitioners Association, where his insights and leadership significantly contribute to the advancement of healthcare practices. Dr. Kashyap Dakshini has 347 Google reviews with an average rating of 5 by his patients. Dr. Kashyap, THIP Media welcomes you, sir.
Hi. Hi,
Hello,
Dr.
sir.
Soumya.
Hello, sir, and welcome to Health Files. Sir, we all understand that, in the present times, stress in any form, significantly affects our heart health. So I'm going to start off this discussion with the most fundamental question that how does chronic stress contribute to the development of hypertension?
Okay. So chronic stress would lead to a persistent elevation or a spike elevation in blood pressure. And
Okay,
this may be because of either job pressure or emotional trauma or emotional stress or loss of a loved one or any kind of reputational stress or any form of insecurity.
okay,
Now, this may lead to anxious situations or constant preoccupation and
okay,
lead to persistent stress, and
right,
hence may lead to elevation in high blood pressure.
okay, right. And you just mentioned that, there could be work stress or emotional stress. So, what exactly are, I'm sure there could be with this 21st century in, and we have lifestyle modifications. So, are these new changes and these new incomings into our lives an aggravating factor to this relationship?
Yes, very true and truly said, Dr. Soumya. So, in today's age, there is lack of sleep, so that's one important risk factor. Then your diet, excessive salt intake or a high calorie diet can be
Okay,
another factor. Then inactivity or lack of exercise or obesity or
okay,
excessive consumption of alcohol or any form of tobacco, whether it is smoking or vaping or chewable tobacco or any kind of stress at work or in relationships. All of these are aggravating factors, lifestyle factors, which may lead to elevation of blood pressure.
okay. And having knowing that these aggravated factors, they do have a role, in increasing our stress and, let's say, blood pressure. So let's understand the mechanism also, the mechanics behind it. So how does chronic work-related stress or stress, let's say, in any form, affect the blood pressure regulation and cardiovascular health in a long term?
Correct. So, work-related stress or any kind of stress will lead to a neurological response from the brain, and
Okay,
that will lead to release of stress hormones such as epinephrine, norepinephrine, and cortisol. Now, these hormones are typically released in fight or fright situations,
right.
which leads to high blood pressure. Now, persistent high blood pressure will definitely damage the arteries, the elasticity of these arteries, and also reduce the blood flow and hence the oxygen supply to the heart and various vital organs. Now, this makes it much harder for the heart to pump blood
Okay,
and may lead to complications of the heart, of the brain, of the eyes, or of the kidneys, which are typically, complications of hypertension. So if it's related to the heart, then it means increased chances of heart attack or coronary artery disease or heart failure, you know, or left ventricular hypertrophy. Then if it's related to the brain, then it could be a chance of a brain stroke or even dementia related to kidney, then typical, chronic kidney disease because of high blood pressure. Or if it's related to the eye, then it's hypertensive retinopathy. So all these are complications of high blood pressure.
okay. So we have a very, very long list of, complications induced by hypertension. So is it correct to say that stressful impact, particularly on heart, is responsible for the silent cardiac deaths? And if so, uh, does technology have a role to play in the identification of these warning signs?
Yes, so truly said, stress does have a huge impact on the heart and can lead to silent cardiac deaths. Whereas
Right.
also some of the risk factors, the usual suspects which elevate high blood pressure, such as diet, inactivity, lack of exercise, obesity, tobacco, or alcohol, family history of heart disease, or age, or gender,
Okay.
or high stress at work. All of these can lead to silent cardiac deaths, even during sleep or even a sudden cardiac death. Now it's important to identify the warning signs. So
Okay.
warning symptoms could typically be chest discomfort, or chest pain, or typical heaviness in the chest, or even any discomfort or pain in the jaw or in the neck or in the back or any kind of shortness of breath. Now, these are typical symptoms of a heart attack. So
Right.
anything from the jaw to the umbilicus, any kind of pain there, which is, typical discomfort,
Right.
can lead to a heart attack. And these warning signs have to be identified. Then, of course, we know that a heart attack can be detected with the help of an ECG machine
Okay.
and also through blood tests, like TROP-T, TROP-I.
Right.
Now, in today's age, we have a lot of smart watches or other, wearables on the wrist, which
Okay.
which do have sensors, which can predict the level of troponin T or troponin I, or even
Right.
obstruction in the artery, with reasonable amount of accuracy and in a matter of minutes. So
Right.
technology does play a role, and we can potentially detect a heart attack with the help of technology. Maybe early days, but still, highly implementable.
Okay, right. So I'm just going to reinforce with whatever you've said that silent cardiac death is actually an emergency which needs to be detected and confirmed with an ECG, and smartwatches can play a very important role in identifying them early, at least identifying them early, right? So again, coming back to the fast-paced world we are still living in that context, how does achieving a healthy work-life balance, play a role in mitigating the effects of stress on blood pressure and heart health?
Correct. So, a healthy work-life balance will definitely lead to low levels of stress because one will also, focus on exercise, on sleep, focus on diet and other things. Now, reduced stress levels will automatically reduce the neurological response from the brain and in
Okay,
turn reduce the release of stress hormones such as epinephrine, norepinephrine, and cortisol. This would in turn reduce the amount of blood pressure and hence the hypertensive response. Now, a healthy work-life balance can easily be achieved. Of course, I'm saying it easy, but yeah, in that sense, a lot of effort in setting manageable goals or in setting your tasks right, in planning your day well, in concentrating well at work, improving your work efficiency, taking regular breaks uh, away from work, communicating effectively, and also then, unplugging yourself, doing a digital detox, getting your sleep, exercise, staying away from gadgets, at periodic intervals so that you can actually do some meditation, some form of relaxation exercises. And, these relaxation techniques will lead to the release of feel-good hormones, such as dopamine, serotonin, endorphins, and also oxytocin. And this will reduce the stress levels.
Okay. And you've just given a beautiful list of how we can at least try and maintain that work balance. So, are there any evidence-based strategies or interventions that individuals can implement, to effectively manage stress and reduce the risk of hypertension and, of course, the related cardiovascular complications?
Yes, truly said. So yes, there has been increasing evidence today of methods of managing stress by way of either mindfulness-based stress reduction or through cognitive behavioral therapy. So
Okay.
mindfulness is basically breathing and concentrating in your breath, doing a meditation through either body scan techniques or through yoga, through exercises. So in yoga, typically you have, if I may use the word dhyan dharana or de dharana, where
Okay.
you concentrate and through imagination or you concentrate on, your body and, it's like a body scan technique. And
Okay.
with this practice, we learn to watch, ourselves, watch our emotions, watch our thoughts, watch our sensations, and then decide to modify the response, rather than a reflex action, or an automatic reaction. One actually controls the response. And this, is done by focusing in the present moment, not by drifting into the past or to the future and worrying, about what happens in the future, but focusing exactly in the present moment, in the here and now. And then the person becomes more aware of his, negative thoughts or physical feelings, and
Right.
then that leads to a response. So there are a lot of randomized based trials of this mindfulness techniques, and this leads to eventually reduced stress, improved memory, increasing the focus or improving the concentration. And then this eventually would lead to reduced, ups and downs emotionally, or even, with improved resilience to face situations. And then you have, cognitive behavioral therapy, where again, the observation is common. One observes one's thoughts, feelings, but then also one is able to actually understand one's own behavior and use problem solving skills, to be able to cope up with different situations and do role plays, and then you're able to face your own situations, face adversities, face your fears, and then calm the mind and relax the mind, and have an improved concentration or focus at work.
Right. So controlling the response and calming your mind. Right. And I mean, you just mentioned some great techniques, but can mindfulness and CBT actually replace conventional medications for hypertension?
Okay. So one should definitely try them first. Before
Okay.
starting with regular medication, one should try both of these, because this is a natural way of
Oh,
controlling your hypertensive response through your body mechanism and brain. So
great.
once tried, of course, it should reduce the requirement of medicines for sure. So
Okay.
if one is able to manage one's response and behavior, then that will reduce the requirement. But yes, if the blood pressure remains high, then one must consult his or her own physician, monitor the blood pressure, and
Great.
you definitely need conventional antihypertensive medication, depending on the level.
Okay. So, what I understand from this is that, it's a very gradual process of rise in the blood pressure. So, if we are able to control them and at least relieve the symptoms at an early age or at an early stage, you might not even need medications, right? Okay. Now could you please shed some light on the preventative measures that could be employed for preventing this high blood pressure brought on by stress?
Correct. So, some of the factors which are, risk factors should definitely be controlled. So, a healthy work-life balance, and managing that by way of, setting your targets, setting your, manageable goals, concentrating on work, improving your efficiency, improving communication, taking regular breaks. We said, unplug yourself, digital detox, diet, exercise, quit tobacco, quit the stick, watch your drinks, a lot of relaxation techniques, uh, you know, uh, a lot of this, and then of course, your mindfulness,
Yes,
relaxation techniques, and even CBT. All of these play a huge role in reducing stress levels. Although one may be born with a family history of high blood pressure,
right.
and with a certain age you develop high blood pressure, but some of these preventative methods will definitely, have an impact and reduce risk.
Okay. Well, that was a wonderful session, sir. And I really appreciate your presence with us today. And I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us.
Thank you, Dr. Soumya. Thank you for the
Thank
opportunity and thank you to your THIP.
Thank you. It's really been a pleasure, sir. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir. Thank
Thank you. Thank you.
you.
Bye-bye.